Hi guys, my name's Bonnie Wagner, Group 1, Methotrexate. Some background: it is used in chemotherapy. It is also used to treat psoriasis and rheumatoid arthritis. It can be used to treat lung cancer, breast cancer, and other fun things. When being administered in chemotherapy, if it is not administered at the right dosage, it can be lethal. And if there are other drugs that you are currently taking, when you start taking methotrexate, you could have a severe reaction or a severe allergic reaction, which can cause your death. So the mechanism of action of the drug relating to one of the figures from the book, when I did my research in chapter 26, it took me to the DNA synthesis at the replication fork. I'm assuming that's because the methotrexate attacks the thymine receptors in DNA synthesis, because methotrexate acts as a competitive inhibitor that binds to the enzyme's active sites in place of normal substrate molecules. Methotrexate displays multifunctional mechanisms of action. It binds to the folate receptor. It surfaces biomarker frequently overexpressed in tumor cells, and also inhibits dihydrofolate reticus, an enzyme critical for cell survival and division. So the pathway the drug interferes with is folate. So methotrexate works by competing with folate in the pathway that synthesizes thymine for uracil. Thymine being one of the 4 nucleotides required for synthesis of DNA, makes it a little harder for cancer cells to reproduce. So because the most rapidly dividing cells in the body are the cancerous cells, they have the greatest need for the synthesis of DNA. Thus, they are more vulnerable to the attack by methotrexate. Again, this is a classic example of the approach in which one hopes the drug kills more cancerous cells than healthy cells, which are all treatments and drugs for cancer, as we hope that they kill the infected cells and not the healthy cells, but there's no way for us to actually moderate which cell it's going to kill and which cell it's not. So since methotrexate acts to inhibit dihydrofolate reticus, a key enzyme in the activation of folate to be used for thymine and purine in biosynthesis, that's what kills off the cancer cells. So they have the miscorpication of bases in the tumor's DNA. A problem with methotrexate is that tumors often can be immune to this type of treatment. And how is the pathway different in normal cells versus cancerous cells? They're different because neoplastic cells are the ones that are more sensitive to the killing by methotrexate than non-neoplastic cells, due to the amount of folate produced when the drug is being administered, whether it is hooked up to you through an IV bag at the hospital, if you're doing self-injections, or if you're taking an over-the-counter pill version of methotrexate. So there's that. Major side effects of methotrexate are unusual bleeding, which is coughing up blood in your stool, vaginal bleeding, or increased bruising, liver problems. Don't get them confused with liver disease or cirrhosis of the liver. The liver problem symptoms could include dark colored urine, pain in your abdomen, yellowing of your skin, tiredness, lack of appetite, Kidney problems, blood in your urine, decreased urination, significant or sudden weight gain. Pancreas problems, severe pain in your abdomen, severe back pain, upset stomach, vomiting. Lung lesions or sores. If you don't know what a lesion or sore is, that is a little blister-like thing that occurs on the surface of the tissue, most commonly found in your mouth, like little fever blisters. That's what a lesion or a sore is. So the lung lesions are dry coughs that don't produce phlegm, fever, shortness of breath. Lymphoma is another major side effect, which is another type of cancer. So the lymphoma symptoms are tiredness, fever, chills, weight loss, loss of appetite. And then you have skin reactions, infections, bone damage and pain, and bone marrow damage. What causes the side effects and how are the side effects of the methotrexate related to the mechanism pathway? That is because methotrexate competes with folate in the pathway to synthesize with thiamine, and when this happens, that's when you start to see the side effects beginning to occur, because those healthier cells are being deprived of the thiamine and purine nucleotide that is required for new cell growth. So if your methotrexate is, competing with the folate, then you're gonna have cells that don't have the cancerous symptoms that are being killed off because they're not getting the appropriate amount of thiamine that they need for DNA synthesis. My question, I guess, would be, given the deadliness of the side effects, is the drug methotrexate really one of the best options for people undergoing chemotherapy to treat psoriasis and RA, which is rheumatoid arthritis? Here are my references, and thanks, guys.